Hello. Today's topic is arthroscopic knee surgery a major surgery? Now, arthroscopic knee surgery is a surgery carried out using a camera and either a laser or a endoscopic instrumentation. In arthroscopic knee surgery, there are only two small openings, portals are done in the knee joint here and here, and camera is introduced through that small portal. So in arthroscopic surgery, the openings are very small and generally 2 or 3 stitches are required for closure of the surgery. Now, arthroscopic knee surgery such as diagnostic knee arthroscopy, repair of the meniscus, ACL reconstruction, PCL reconstructions are middle level or major surgeries, but major in the terms of reconstruction of the ligament and not in the terms of openings of the knee. So arthroscopic knee surgeries can be categorized as medium level surgeries. Sometimes when there is multi-ligament rupture, that time all 3 or 4 ligaments and meniscus need to be repaired. That time arthroscopic knee surgery can become a supramajor surgery. The recovery from arthroscopic knee surgery is very fast, so it can be categorized as medium to major level of surgery. Thank you.